Hi, my name is Alyssa McCarthy. I'm a student at the College of Nursing, and today I'm going to be performing a wet to dry dressing change. So the first thing I would do is I would grab my order sheet and I would verify the order. So this patient does have a normal saline wet to dry dressing change to HIP every 4 hours. And the next thing I'm going to do is I would check the hospital policy. Then I would also identify the patient by two identifiers. So his name is Jaguar Jones, his birthday is 8/25/1963, and his allergies include penicillin. And so now I'm going to put this off to the side, and I'm going to perform hand hygiene. So for me to perform hand hygiene, I am going to have to move my computer. And so now I'm going to turn on the water to warm temperature, and I'm gonna remove any jewelry I have on, anything like that. I'm gonna push up my sleeves if I have sleeves, and I'm gonna check my fingers, my nails, my hands, my forearms for any scrapes, lesions, open wounds, anything like that. And so now, since the water is warm, I'm gonna rinse my hands. I'm gonna apply 3 to 5 milliliters of antimicrobial soap. And I'm going to lather for at least 15 seconds, getting under my fingernails. Now I'm going to rinse. And so I'm going to take one paper towel and wipe from the fingers down. I'm going to drop it in my trash can right here. And I'm going to take another paper towel to turn off the sink. And so hand hygiene is important because you want to use it when your hands are visibly soiled and also when you come into microorganisms such as C. diff. And you are allowed to use an antiseptic rub when you are entering and leaving a room and when you are moving furniture or touching any bed linens, anything like that. So now I'm going to move my computer back to perform the dressing change. I'm also going to move my trash can that's right here as well. And now, since I did move both of those, I'm going to put on some antiseptic rub. And so now I would raise the bed and lower the side rail and position the patient comfortably. I would provide him privacy with a drape or curtain or anything like that. Now I'm going to apply my gloves and goggles. And so now I'm going to remove the dressing, pulling towards the wound and turning it away from the patient. And so now I would assess the drainage. I would assess the amount, the consistency, the color, and if there was an odor. And then now I'm going to take out the inside, being careful not to touch the side of the wound. And so now I would look inside the wound, looking for any granulation, slough, or necrotic tissue. Then I'll palpate around the wound, looking for any redness, edema, tenderness, or if it gives any pain to the patient. So now I'm going to dispose of this inside my gloves. I'm just going to drop it in my trash can. And so now I'm going to set up the sterile field. So I'm going to open the kit. I'm going to grab the sterile field, being mindful of the 1-inch border. I'm going to fan it away from my body. And so now I'm going to empty the contents onto and making sure that they are well away from the 1-inch border. And now I'm going to take my saline. I'm going to check the expiration date. I'm going to have the label towards my palm. And when I take off the lid, I'm going to lift straight up and turn it so the cap is facing up. I'm going to pour it. And when you pour it, you want to get close to the container, but not close enough where you are touching it. You want to reduce any splashes, because if any splashes get onto the sterile field, then it is contaminated. So now I'm going to put on my sterile gloves. So I'm going to open this. And so I'm going to put on my left glove first, making sure to only touch the part that will touch my skin. And then I'm going to take these 2 fingers, slide it under the right glove, and slide my hand in. And then now I'm going to put what I need to in the saline. And I also want to take note that this is a little under my waist level, so this would not be okay for a hospital setting. I would want it higher, above waist level, so I'm not reaching over everything, the sterile field, and I'm not dropping my hands below my waist. And so now that is in this, since that is in the saline, I'm going to perform on a suture line. And so the first thing I would do is I would look to make sure that I would check the size, I would check the edges, I would make sure there was no drainage or swelling or anything like that. So now when you clean it, you want to grab one of these and squeeze it out. And you want to make sure when you wipe it, your gloves will not touch the skin. So you start with the cleanest first, so I'm going to wipe right down the middle. And then step back and just drop it into my trash can. And then do the same thing, but do it on the side. Make sure your gloves would not touch the side or the skin. Step back, drop. And I'm going to wipe the other side, step back, drop. And now I'm going to pat it dry. Step back, drop. And so now I'm going to pack the wound. So when you pack the wound, you want to fluff the gauze. So when you do that, you want to open it back up and you want to lightly pack it. I'm going to do the same thing again. And you don't want to stick your hand in there and touch the side of the wound. And then I'm going to put this over it. And so now I'm going to grab my ABD pad and place it on top. And you want to be sure you are only touching the outside of it. And so now that I have that, I'm going to remove my sterile gloves. Put this glove inside and touch skin to skin. And then drop those in the trash can. And I'm going to take my tape and tape it down. And so also, once I'm done with that, I would take a piece of tape and I would put it on top, and I would have my initials, the date, and the time, so the next nurse knows who it was changed by and when it was changed. And so then I would reposition the patient so he is comfortable. I would lower the bed and raise the side rails back up, and I would perform hand hygiene again. Lather for 15 seconds with 3 to 5 milliliters. Once again, check my hands for anything. And then now I would I would also, or before I did hand hygiene, I would clean up my workspace, and then once I was all done with everything, I would go and document what I found. I would document the suture line, what the size, if there was drainage, if there was anything abnormal with that. And then I would also document what I found with the open wound, if there was any redness, edema, tenderness, and what type of tissue was on the inside, and also what I found with the drainage, the amount, the color, the consistency, and if there was an odor. And that concludes my wet to dry dressing change.